Denizen. I'm Dr. Silva. Thank you for joining me for this talk on the anxious patient. I just had a visit with a new patient who is plagued by severe social anxiety as well as generalized anxiety disorder, basically major anxiety syndrome, what I call major anxiety syndrome. She has some sort of serotonergic deficit. We don't really know what the pathophysiology is. And she's plagued with uncertainty. And what her mind does, it's really quite dramatic. Even in speaking with me, she is constantly apologizing. She is very scattered in her speech. She's so distracted by what I might be thinking and how I might be judging her. And she's so busy apologizing for it, kind of beating me to the punch and letting me know that she's just, I'm sorry, that I'm not making sense. I'm all over the place. And she's so nervous. And it's really unnecessary. She's being very hard on herself, but it's because of this anxiety that's plaguing her, and in particular, interpersonal anxiety, social anxiety. And meanwhile, she's interjecting how frustrated she is at her inability to leave the house, to interface with other people, to do the things that she's supposed to do, go to school, to drop off records for her son. And she doesn't want to get out of the house because it's so anxiety provoking. It's so much harder for her than it is for other people. And it makes her frustrated. And it's difficult to go to AA meetings. Her sponsor actually has to come to her house to give her chips because she can't bring herself to go to meetings and to get up and share and to stay after the meetings and chit chat with the other members. And it's really severe and it's very limiting. And so she needs medication. She has a condition, endogenous anxiety, innate anxiety. It's genetic. She's had it all her life. And she's really not had adequate treatment, but she's also not been sober until recently. So now she has been sober for 2 years. She has her sponsor. She's doing what she's supposed to do. And for the first time, we are embarking on treatment. But while we're waiting for this Prozac, I started 20 milligrams of Prozac, but it needs to be doubled or tripled. The target dose is 40 to 60 at a minimum, and we might need to add another medication, and it's going to take 8 to 12 weeks before we will even be anywhere near remission. And so it's going to take a while. In the meantime, what she has to do is she has to be mindful. Mindfulness, which consists of being in the present moment, because what her mind wants to do is either dwell in the past or anticipate the future. And the amount of projection that she was doing, she was worrying about things that not only are not happening, but that might never come to pass. Projecting into the future, and for example with school, and they're going to want me to join the PTA, and I can't do that right now, and etc., etc. And no one's asking her, much less pressuring her to join the PTA. And I have to remind her, that's not on your plate right now. You're projecting into the future. That's not happening. That's not real. And the same with the AA, and I don't think I can go. And when I'm supposed to get my 2-year chip, and I don't think I can go to that meeting and be in front of all those people and make a speech and then stay afterwards. And again, that's not happening. That's not real. The only thing that exists, and this isn't philosophic, this is fact. The only thing that exists is the here and now. The only thing that's real, the only thing that's happening, the only thing that any of us have to contend with is what is going on right now. And it's so useful when we are feeling anxious in particular, because anxiety always is taking place in the past or the future. Anxiety is never really taking place in the current moment. There are exceptions. There are moments where you're actually dealing with the stress. You're actually dealing with whatever the crisis is. It's actually happening right now. The building is on fire right now. You're looking at your house, it's on fire right now, and you're having to find the fire extinguisher. But most of the time, 98% of the time, whatever the problem is, whatever the thing is that is hurting us, whether it's a divorce or problems at work or financial problems, whatever it is that we're worried about, not being able to pay the light bill, the lights aren't going off right now, or getting divorced and being lonely. You're not lonely right now. You're not even separated right now. Whatever it is, the problems at work, if you examine it, 98% of the time, the part of it that would be so harmful and hurtful and that would actually have you in agony is not actually happening right now. It's something that is to come, or it is a calamity that is largely imaginary. It's in your mind, and it may eventually come to pass. Eventually the divorce will be final and your heart will be broken and that person will have moved on, and then you're going to have to contend with not being married anymore to that person that you still want to be married to. I'm not saying that the entirety of the problem or the stressor is imaginary. What I'm saying is, if you just take a breath and look at what's going on right now, right in this moment, even if something awful, even if you're being blackmailed, right now in this moment, take a deep breath and look around. Nothing bad is happening in this moment. Now, the anxious person will say, yes, but, I'm being blackmailed and this is gonna happen and this is happening. It is, and I'm feeling it. And sometimes, it's easier said than done, and you need to take medicine. When you have a disorder where you're constantly catastrophizing, no one is even blackmailing you, or you're not getting divorced and you're not getting fired. It's the what ifs. It is your mind. It's a chemical imbalance, and you're actually inventing they're going to ask me to join the PTA, or I'm going to have to get up and give a speech, or this or that, or what if. And it really is a disease. It is a condition that is making you suffer when there's no need to suffer, because nothing is actually happening. There isn't even a stressor. Even the stressor is something that you're inducing. Or if there are stressors, then you're catastrophizing. You're making them into calamities. And again, it's so powerful to be mindful, to take a deep breath, because you're probably breathing shallow and your heart rate is up and you're panicking. And this patient was doing that, and everything was such a calamity, and she couldn't even speak. She couldn't even organize her thoughts. It was taking her forever just to tell me that she wasn't even taking the Xanax 3 times a day, because she wanted to demonstrate to me that she wasn't abusing the medicine. And that was a problem. Yet another problem that she created in her mind, the problem of that she's an alcoholic who's 2 years sober, but I've prescribed her Xanax, and that could be considered her not being sober, and she wanted to make absolutely positive that I understood, and she's got the pills next to her so that she could show me, and the compulsions that come along with being that anxious, the compulsion to prove it to me, to show me, to already have it all rehearsed and all laid out for me. It's dizzying what the mind does. But I was able to calm her down, to reassure her, to let her know that over time she will trust me, and I'll be one of those people, like her sponsor and her hairdresser, that she can actually talk to, because in her mind she's actually done some cognitive behavioral restructuring where, that's one of the safe people. That one-on-one, I can be okay with that person. But otherwise, it takes time to get there, and it happens on a case-by-case basis, one person at a time. And that's part of the illness of social anxiety disorder. And some people can't even do that. But all I could do was tell her to increase the dosage of her Prozac, to double it, and we're going to divide it so she can tolerate it a little bit better. And even, she's not having side effects now, but I alluded to minimizing any potential side effects in the future. She wanted to know what they were. And we kind of laughed about it because I kind of declined to tell her. But she wanted to know. And I got her to promise not to Google by telling her one of them. And I picked, of course, one that would be the least scary. And I promised her that she wouldn't get any weight because that's one that she was very concerned about. And luckily with Prozac, I was able to make a guarantee. And we kind of laughed, but I told her that whatever side effects might come up, none of them were life-threatening and none of them were permanent, and that I didn't want to give her anything to look for, but we would deal with them. And anyway, she was like, hair's not going to grow on my face, is it? That patients who have this syndrome they're beside themselves with worry, and their thoughts are contaminated by what other people are going to think, and they're so distracted, and they are judging themselves. It's really a projection. They're so busy judging themselves and then projecting that onto other people, and what are they going to think, and they're probably going to think this. And then she was also judging other people. This is so stupid, and they're so stupid, and they gossip with the millennials, and my kids aren't like that, thank goodness. And so her mind is like insisting on thinking about negative things that aren't even true. So in thinking about how her children are not millennial brats, she has to think about millennial brats, disdain them, be bothered by that. And so she has this negative experience and this disdain and this anger, even though it's in the context of thinking that her kids aren't that way, thank goodness. You see how the mind works when it's plagued by anxiety? There's not enough serotonin. So instead of just thinking, my kids they're good kids. They're doing well. I have this one special needs child, but my other kids, they're doing well. I don't have to worry about them. They're great. You don't have to go into the negative of they're not like other kids of their generation who are stupid and spoiled and blah, blah, blah. Why go into the negative? Because that's how her mind works. There's not enough serotonin, or her neurons don't know what to do with the serotonin that's there. And so she's always with the negative. Always, always. It's a compulsion. Even when really the whole point is something positive. But in as much as I asked her to adopt the mantra of, that's not real, what's going on right now, look around you right now, what am I faced with, what's in front of me, 98% of the time it's not on fire, it's something that is all right, and that can help calm things down. In as much as she's going to have to tell herself to do that over and over and over again until the medicine is on board at the proper dosage, then we're going to have to do that. And the analogy that I made to her, and this is perfectly analogous because it's the same, people who have this kind of anxiety often will have these tics, or for example, like biting your nails. And this patient didn't do that, but a lot of times patients with high anxiety will have those habits, so they'll bite their nails. And it is the same pathophysiology, it's the same chemical imbalance. Even though not everybody has it, those who do have it, it's the same disease process really. It's just an aspect of it, in my opinion. And like biting your nails when you're anxious or when you're bored, also boredom is another stress on the brain that, like anxiety, that will cause it. But a person will be biting and biting and biting, and they tell themselves to stop. But then if they become distracted, it happens again. So it's not entirely involuntary because they can voluntarily suppress it, but it is automatic. If they don't think about it, they'll start doing it again. And if it's really bad, they might have to tell themselves 50 times, stop biting your nails, or other people will tell them, stop. Or it's like worrying and telling themselves, stop thinking about it. I'm gonna stop. And they can't because they're compelled to do it. They're different. It's a spectrum of severity, so it just depends on how bad your condition is. But once the medicine is on board, then you're just not biting your nails. You're just not doing it. You're not having to tell yourself to get your fingers out of your mouth. You're not only not having to do that every 5 minutes, you're not having to do it at all because you're not even thinking about it. You're not even thinking about it is the reality. But if it were pointed out to you, you would just say, I don't feel like biting my nails. I don't feel the need to. That itch isn't there. I don't have the urge to do it. And the reason is because brain chemistry has changed. And so analogous to that, the worry and the overthinking and the projecting and all of the other defense mechanisms, the apologizing and all of that, it just stops. It just stops when the medicine is on board. So I'm really looking forward to this patient calming down a little bit. It's been 50 years. But I tell her, you've been this way for 50 years. So it's going to take us a while. It probably will take us a few months. And I'll probably will have to, if we really want to get into remission. And I mean, it's stubborn. I don't expect that these symptoms are going to go away 100%. It'd be lovely if they did. But I think that probably we'll get, 90% better. There will still be some tendencies, but she'll be able to, with the combination of staying sober and then the mindfulness and other techniques, other cognitive behavioral strategies, and the medicine. And she's going to be able to get out of the house and let other people see her. She is very attendant to her appearance. And she says, but then nobody sees me. Nobody sees me. I get all of this, I go to the hairdresser and she attends to her. She's got a skin regimen and all of this, but she can't get out of the house. And it's because of social anxiety. It's not agoraphobia in the sense that she's afraid of being outside of the house because she's afraid that she won't be safe. The danger is the emotional burden of having to interact with other people, interpersonal anxiety. It's just too much for her. It's too much. She would rather hide. So thank you for listening. I just had to record something about this because I just saw her and it was just very impressive. And there are a lot of patients out there with this syndrome. And so please go see a doctor and get on medication if you've got this going on, because what you need is medicine and you need to be on medication the rest of your life. And I'm not going to say unfortunately, it's actually fortunate that we have developed medications that are effective, even though these symptoms are very stubborn, and that can really improve the quality of life. For some people, it like this lady, it's going to be life-changing, life-altering. And I can't wait to see that. Thank you for joining me.